In this section, we will review common chest X-ray abnormalities. The red arrow points to a fracture of the lateral aspect of the 8th right rib. This is a zoomed-in view of the previous chest X-ray displaying a rib fracture. These are PA and lateral views of a patient with a small pleural effusion. A pleural effusion is a collection of fluid between the visceral pleura and the parietal pleura. In upright films, the fluid collects in the posterior lateral costophrenic sulcus due to gravity, which gives it a blunted appearance. These are PA and lateral views of a patient with a large pleural effusion. Notice that almost the entire right hemithorax is whited out. Pneumothorax is the air between the parietal pleura and the visceral pleura. This is a PA chest X-ray of a patient with a right-sided pneumothorax. Notice a black crescent over the apex of the right lung. This black crescent contains air and does not have any lung markings. Note that a pneumothorax may be made more obvious by taking the X-ray during expiration, when the lungs become smaller while the amount of pleural air remains the same. This is a chest X-ray of a reticular pattern of interstitial disease of the right lung. The reticular pattern has the appearance of thin, well-defined linear densities in a net-like arrangement. This pattern represents the presence of fluid density material in the interstitium, for example, inflammatory fluid. This is a close-up view of a reticulonodular pattern of interstitial disease. In addition to the innumerable thin white lines of the reticular pattern, tiny white nodules are also seen. On your left is a close-up view of a chest X-ray of a honeycomb pattern of interstitial disease. The honeycomb pattern signifies long-standing interstitial lung disease and irreversible scarring. The honeycomb pattern is seen in pulmonary fibrosis and asbestosis. On your right is a CT image showing the honeycomb pattern. This is a chest X-ray of a patient with a miliary pattern of interstitial disease. The miliary pattern refers to innumerable pellet-sized opacities appearing diffusely in both lungs. This pattern is often seen in miliary tuberculosis. This is a chest X-ray of a patient with a right-sided pneumonia. Normally, the thin walls of bronchi are not visible because they are filled with air and are surrounded by air. However, if the surrounding air spaces become filled with a fluid density material, the air in the bronchi become outlined on the radiograph. This appearance of dark branching markings in abnormal white lung is called an air bronchogram. This is a zoomed-in view of the previous chest X-ray showing an air bronchogram. This is a chest X-ray of a patient with a right middle lobe pneumonia. Notice that the right heart border is poorly seen. This loss of a normally appearing interface, which is usually due to an opacification in the lung, is known as a silhouette sign. This is a chest X-ray of a patient with a right lower lobe pneumonia. Notice that the margins of the right hemidiaphragm are poorly seen. This is a chest X-ray of a patient with a left lower lobe pneumonia. Notice that the margins of the left hemidiaphragm are poorly seen. In pulmonary edema, fluid backs up into the pulmonary veins in the lung. This results in vascular redistribution, a reticular pattern, Kerly B lines, peribronchial cuffing, thickening of fissures, and as the pulmonary edema progresses, a bat wing pattern may be seen. On this chest X-ray, notice the reticular pattern and the thickened minor fissure. Also, notice the vascular redistribution, where the blood vessels in the upper lung zones are larger than the ones in the lower lung zones, which is the opposite of normal. This close-up view shows Kerly B lines seen in pulmonary edema. This is a close-up view showing peribronchial cuffing. The bronchial seen has an edematous wall, making it appear thicker than normal. This chest X-ray reveals an enlarged cardiovascular shadow. The underlying cause of the enlargement in this case is dilated cardiomyopathy. This is a chest X-ray of a wide mediastinum. The arrows point to the aortic aneurysm causing the mediastinal widening. The end.